Hi, my name is Mary Stoa. I'm a medical student at the University of Washington, and my project is Sexually Transmitted Infections Educational Campaign in Hill County, Montana. So a little bit of background on Hill County. The county is positioned in the north central area of Montana. There are about 16,000 people with a strong indigenous population. And looking at this map, you can see Hill County is the red bit, and then the green lands throughout the state is native land. And the population is pretty transient because of the railroad industry going through the area. In terms of recent STI data, Hill County, interestingly, has over twice the rate of STIs than the state county average, and over 1.5 times that of the national county average. Specifically for syphilis, since 2021, Hill County has seen a 700% increase in syphilis and an 1,800% increase in congenital syphilis. In terms of the community's perception of STIs, there aren't any current public health initiatives to address the rising rates of STIs, and parents and local employees at the health facilities aren't aware of any strong sexual and reproductive health education in the school systems, nor are they aware of the rising STI rates. So if the healthcare providers aren't aware of these rising rates, how is the community expected to be aware of that as well? So to develop this educational campaign, we turned toward the literature to learn more about what specifically are rural communities facing that are causing this disparity in increased STI rates. And we found that the negative stigma, the lack of resources, and the difficulty accessing those resources are the big three players contributing to this STI disparity. And we also turned toward the literature to learn more about what tactics have been used that successfully address those disparities. And we found that education is the biggest player, especially when combating the negative stigma. And the education can come in the form of public health advertisements and easy to access resources such as telehealth. And then to combat the fear of lack of privacy, increasing accessibility combats that. So providing at-home testing kits and online educational resources is huge. And then the literature also strongly emphasized the importance of creating content that is community specific for the highest rate of community engagement. So this educational campaign came in the form of a website called Healthy Hill County, and it centralizes all the information regarding STIs kind of in the form of a Q&A. So you'd come to the website and ask, what are STIs? What are the symptoms? How do I get tested? How do I get treated? And why should I care? And the why should I care is specific to Hill County with the rising STI rates there. And resources backed by the Indian Health Services and the Montana Department of Health and Human Services are also highlighted throughout the whole website for community engagement. For further sexual and reproductive health education, other resources are linked that are very reputable and well established, and they were created by the Indian Health Services, Planned Parenthood, and the Violet Project by Kids for Kids to make it as interactive and engaging as possible. So to publicize this educational campaign and the website, we printed off these posters with the QR code and put them up all throughout town in the bathrooms of gas stations, casinos, restaurants, in the dormitories of the local college, in the local clinic and hospital. It was sent to other community centers and to the local health department. Thank you.